A groundbreaking study has transformed the lives of 76 chronic kidney disease (CKD) patients by focusing on just one key mineral. The result? Dramatic improvements in creatinine levels, the primary marker of kidney function. In today's video, we'll take a practical look at how you can benefit from these findings. Today, we're diving into a breakthrough approach to lowering creatinine and supporting kidney recovery. Whether you've been diagnosed with CKD or simply suspect your kidneys may be at risk, this video could hold the answers you've been looking for. The research we're going to share with you today found a surprising link between thyroid health and kidney function. Researchers observed that CKD patients with hypothyroidism experienced significant improvements in kidney function after restoring normal thyroid levels. In many cases, creatinine levels dropped back into the normal range. The only intervention? Balancing thyroid hormones. Now you might be thinking, but my doctor never mentioned anything about thyroid problems. Here's the truth. Nearly all CKD patients experience some degree of thyroid dysfunction, often without knowing it. That's because kidney damage leads to mineral and bone disorders. When your kidneys are impaired, they can't properly regulate calcium, phosphorus, and magnesium levels, key minerals that influence both thyroid and kidney health. An imbalance in these minerals can cause phosphorus to rise, which accelerates kidney decline, and calcium to drop, leading to brittle bones. In response, your thyroid, specifically, the parathyroid glands, tries to compensate by releasing more parathyroid hormone. This cascade worsens kidney damage unless it's addressed early. The good news? New treatments targeting mineral and bone disorders are showing promise in reversing kidney damage. With just one vitamin and one mineral, you could support your thyroid, correct these imbalances, and potentially improve your kidney function. If you have CKD, ask your doctor to check your phosphate, calcium, and parathyroid hormone levels. Taking action to normalize thyroid function and restore mineral balance could be a game changer in your journey to better kidney health. Alright, now that we've covered what impacts kidney health, let's talk about how to fix it, starting with mineral and bone disorder, one of the most overlooked but critical aspects of CKD. But before we begin, quick question: how old are you right now? Drop your age in the comments. We are reading and replying to each single one. Now, let's kick it off with food number 8, a simple everyday ingredient that quietly helps your joints rebuild collagen from the inside out. Step 1. Restore calcium balance. The first thing we need to address is calcium. While you might think calcium supplements are the obvious solution, they don't work as well for kidney patients as you might expect. Direct calcium supplementation offers limited benefits except in one specific case: it can help block phosphorus absorption when taken during meals. More on that in a moment. What your body really needs to optimize calcium levels is a combination of vitamin D and vitamin K2. Here's why. Damaged kidneys lose the ability to convert inactive vitamin D from food or supplements into its active form, calcitriol, which your bones and body actually use. Despite its name, vitamin D is technically a prohormone, not a vitamin, and it's essential for absorbing calcium from food. If you have kidney disease, you may need to supplement with either prescription calcitriol or vitamin D3, cholecalciferol. Whichever option you choose, it's vital to monitor your vitamin D levels, as most CKD patients are severely deficient. And don't forget vitamin K2. It plays a crucial role in directing calcium where it belongs, into your bones and teeth, not your arteries. Supplementing vitamin D without K2 can increase your risk of vascular calcification, which worsens heart and kidney health. If you want to restore kidney function, you must maintain optimal vitamin D levels, and always pair it with vitamin K2. Step 2. Support thyroid health with iodine. Next, let's talk about iodine, an essential mineral for thyroid function and indirectly, for kidney health. The thyroid gland runs on iodine. And improving thyroid function has been shown to directly benefit kidney function, especially in patients with subclinical hypothyroidism. Now, most people assume iodine deficiency is rare because table salt is iodized. But here's the problem: if you're limiting salt intake due to CKD or high blood pressure, as most patients are, you could be unknowingly short on iodine. In fact, studies show nearly 1/3 of the global population may be iodine deficient. So here's a powerful, natural solution: add wakame seaweed to your diet. Wakame is a type of edible seaweed rich in iodine and other essential nutrients. Sold dried in most supermarkets, it rehydrates quickly and can be used just like leafy greens in soups or salads. It's one of the easiest ways to boost iodine intake naturally. Even without obvious thyroid symptoms, CKD patients should have their thyroid function checked. Some may need medications like levothyroxine, a synthetic thyroid hormone, as used in the study mentioned earlier. Healthy thyroid function supports healthy kidneys. Eat iodine-rich foods like wakame and discuss thyroid testing with your doctor. Step 3. Control phosphorus, the hidden danger. Phosphorus is one of the hardest minerals to manage on a kidney-friendly diet, but controlling it is non-negotiable. When phosphorus builds up in the blood, it pulls calcium from your bones and accelerates kidney damage. That's why foods like milk, cheese, butter, and yogurt, all high in phosphorus, are restricted on the CKD diet. Prescription phosphate binders can help, but there's a lesser-known, over-the-counter alternative that works surprisingly well: calcium carbonate. Commonly sold as an antacid, think Tums, calcium carbonate binds to phosphorus in your food when taken with meals. This prevents your body from absorbing it, allowing excess phosphorus to be excreted through your digestive system. In one recent study, patients saw significant improvements in phosphorus levels and kidney function within just 3 weeks of using calcium carbonate. Not only is it effective, but it may also cause fewer side effects than many prescription binders. If phosphorus is a concern, or if you've already been prescribed a binder, ask your doctor whether calcium carbonate could be a safer, more affordable option. In summary, balance calcium with vitamin D and K2. Support your thyroid with iodine-rich foods like wakame. Control phosphorus using safe, effective tools like calcium carbonate. These 3 steps can make a real difference in restoring kidney function naturally and effectively. Now, before we wrap up, there's one final step, and it could be the missing link that brings everything together. Researchers have identified a critical mineral that plays a vital role in nearly every function of the body. Just like essential vitamins, you cannot survive without it, and yet, deficiency is extremely common in people with kidney disease, especially those on diuretics. The mineral I'm talking about is magnesium. For years, it was believed that raising magnesium levels through supplements was ineffective, but new research tells a different story. And if you're living with CKD, this may be one of the simplest and fastest ways to support kidney repair. Why is magnesium so important for kidney health? Low magnesium levels are linked to poor sleep, high blood pressure, inflammation, high uric acid levels, and even a greater risk of ending up on dialysis or worse. In fact, low serum magnesium is associated with higher mortality in CKD patients. For many, supplementing magnesium can bring immediate benefits, not just for kidney health, but also for better sleep and blood pressure control. That's why I recommend taking magnesium before bed, to promote deep, restorative sleep while nourishing your kidneys. Now, here's where it gets specific. Not all forms of magnesium are effective. You've probably heard of magnesium carbonate, citrate, sulfate, and others. But studies in CKD patients have shown that magnesium citrate and carbonate do not significantly raise serum magnesium levels. So what does work? Magnesium oxide. In a study on hypertension in CKD patients, those who supplemented with 300 to 400 milligrams of magnesium oxide daily saw the greatest improvements in blood pressure and kidney markers. Even better, combining magnesium with vitamin B6 was shown to boost absorption and improve results. In summary, magnesium deficiency is common and dangerous for kidney patients. The most effective form for raising blood levels is magnesium oxide. The optimal dose is 300 to 400 milligrams per day, ideally taken with vitamin B6 and before bedtime. Talk to your doctor if you have CKD, high blood pressure, or diabetes. Correcting magnesium levels might be one of the easiest ways to lower creatinine and protect your kidneys. Alright, today we've seen how balancing just a few key minerals can make a dramatic improvement in kidney health. But minerals aren't the only game changer. Certain vitamins can have just as powerful an impact. We're tackling one of the most overlooked but devastating complications of chronic kidney disease: iron deficiency anemia, or IDA for short. We'll talk about the right foods, natural supplements, and simple lifestyle changes that can set you on the path to real improvement. It can also lead to lower creatinine levels, improved oxygen delivery to tissues, and a much greater chance of delaying or even avoiding end-stage renal failure. Yet despite how serious this condition is, anemia remains shockingly underdiagnosed and undertreated. Recent studies show that up to 72.8% of people with chronic kidney disease suffer from iron deficiency anemia. That's an overwhelming majority. But here's the catch: only about 4% of those people are receiving proper treatment. Even more alarming, most aren't even getting their iron levels tested in the first place. That's why we need to talk about this. This is a silent crisis that's making life harder for millions of kidney patients, and awareness is the first step to change. So if you know someone with kidney disease, please share this video. You could be helping them catch something their doctors haven't. I'll walk you through 5 simple, effective steps to start treating and reversing anemia naturally through diet, supplements, and smart lifestyle choices. Step 1. Do you have iron deficiency anemia, IDA? The prevalence of iron deficiency anemia, IDA, in people with chronic kidney disease at any stage is much higher than most people realize. One major reason? Lack of routine testing. So, the first thing you need to do if you haven't already is get your iron levels checked regularly. This is especially critical if you've never been screened before. Don't assume you're fine just because your doctor hasn't mentioned it. There are also common warning signs of IDA that shouldn't be ignored. These include constant fatigue or weakness, headaches, poor concentration, pale skin, hair thinning or hair loss, dizziness, shortness of breath. If you're experiencing any of these symptoms, don't wait. Bring it up at your next appointment and request a full iron panel. Early detection is key, because untreated IDA can accelerate the progression of chronic kidney disease. Unfortunately, many practitioners still follow outdated guidelines and may overlook IDA in kidney patients, so you need to be your own advocate. Be proactive. Ask the right questions. The earlier you address it, the better your outcomes will be. Step 2. Improve the way you eat. Now let's talk about your diet, because what you eat can make or break your progress in fighting IDA. One of the reasons IDA is so common in kidney patients, especially those following a plant-based diet, is the lower bioavailability of iron in plant foods compared to animal products. That said, a plant-based diet can still work incredibly well. You just need to strategically include the right iron-rich foods. Let's go over a few of the best options. Spinach. This leafy green is a powerhouse when it comes to plant-based iron. But it's not just the iron, it also provides key nutrients that support iron absorption and blood health. Oats. Not only are oats a great source of iron, but studies have linked oat consumption to improved serum albumin levels in CKD patients, making them one of the few foods that directly improve overall nutritional status. Just remember, oats don't contain vitamin C, which you need for proper iron absorption. So pair them with fruits like kiwi, strawberries, or lemon. Green beans. While most legumes are rich in iron, they're often too high in protein for someone with chronic kidney disease. Green beans are the exception. They're low in protein and calories, but high in antioxidants and nutrients that fight inflammation and support kidney health. In fact, green beans have less protein per serving than a single slice of bread, making them perfect for a renal-friendly, iron-rich diet. And here's a simple strategy that works wonders. Combine iron-rich vegetables like spinach, kale, beet greens, or Swiss chard with vitamin C-rich foods like lemon juice, strawberries, or kiwi. This boosts the bioavailability of non-heme iron, helping your body absorb and use it more effectively. In short, improving your diet alone can significantly raise hemoglobin levels and even help lower creatinine in many patients. For some people, this change is enough to resolve IDA completely. For others, additional steps like supplementation may be needed, and we'll cover those next. Step 3. Supplement the right nutrients. We've already covered the most essential nutrient for tackling anemia, but there are 3 more key players you absolutely need to know about. The first is vitamin B9, also known as folate. Folate is essential for the production of hemoglobin, and many people with chronic kidney disease are dangerously low in it. A deficiency in folate can directly cause iron deficiency anemia, IDA, and speed up the progression of chronic kidney disease. In fact, studies show that patients in stage 3 CKD who supplemented with 0.8 mg of folate per day, double the recommended daily allowance, experienced significantly slower disease progression. Next is vitamin B12, cobalamin, often called the energy vitamin. Like folate, B12 is critical for forming healthy red blood cells and fighting IDA. These 2 vitamins actually work together to produce hemoglobin. Without enough B12, your iron levels and energy will suffer, even if you're eating well. And if you follow a plant-based or vegan diet, you're at an even higher risk of deficiency, since B12 is found almost exclusively in animal products. The third nutrient is vitamin B6. This often overlooked vitamin is absolutely essential for hemoglobin production. No B6 means no hemoglobin, and unfortunately, B6 deficiency is common, especially among kidney patients. Without it, even optimal iron intake won't be enough. Now, there's one more nutrient that deserves a spotlight. Not only is it FDA approved for treating IDA, but it's also one of the most powerful tools for lowering creatinine levels and improving kidney function. We'll cover that in the next section. Step 4. Powerful tips and tricks to boost iron naturally. Let's talk about a few surprisingly effective lifestyle hacks that can help increase your iron levels naturally and affordably. One of the best tools? Cast iron cookware. Cooking with cast iron, especially when using acidic ingredients like lemon juice, vinegar, or tomato, allows a small amount of iron to leach into your food. This is actually a good thing. It's an absorbable, food-based form of iron that supports your body's needs without pills or side effects. Just make sure to clean your skillet by hand, as using a dishwasher can strip away the seasoning layer. Now, if cast iron sounds like too much maintenance, there's an easier option: the Lucky Iron Fish. This small, reusable tool is added directly to soups, stews, or boiling water. It releases 6 to 8 milligrams of highly bioavailable iron per use, enough to make a real difference. It's a simple, cost-effective alternative to traditional iron supplements. Another surprising tool? Probiotics. You might be wondering, what do gut bacteria have to do with iron? Quite a lot, actually. There's a specific strain, Lactobacillus plantarum 299V, that has been shown to significantly improve iron absorption from both food and supplements. This is a game changer, especially for those who struggle to get their iron levels up despite taking supplements. Supporting your gut health with the right probiotic can help you absorb more iron naturally, with fewer side effects. Coming up next, we'll talk about the final nutrient that ties everything together, and it may be the most important one yet. Step 5. The most powerful supplement for IDA and kidney health, L-carnitine. Now it's time to introduce one of the most powerful and effective tools for improving iron deficiency anemia, IDA, reducing inflammation, and slowing the progression of chronic kidney disease, L-carnitine. L-carnitine is a naturally occurring compound that plays a critical role in your body's energy metabolism. But its benefits go far beyond that. It also helps reduce inflammation, lower blood pressure, and support overall kidney function. Here's the catch: L-carnitine is found almost exclusively in animal products like red meat, poultry, and fish. So, if you're eating little to no animal-based foods, or if you're in stage 4 or 5 of CKD, your carnitine levels are likely far too low. And that can accelerate the progression of kidney failure. That's where supplementation comes in. In fact, data shows that 8 out of 10 people with advanced CKD or IDA are likely deficient in carnitine. That's why supplementing 1,000 milligrams twice daily of acetyl L-carnitine can have a profound impact. Why does this work so well? Because many kidney patients suffer from what's called secondary carnitine deficiency, a condition where your body doesn't make or retain enough carnitine due to kidney dysfunction. This is why L-carnitine has been FDA approved specifically for the treatment of anemia and chronic renal failure. Few supplements have earned this recognition because few deliver results like this one. In one study, 2 grams of acetyl L-carnitine per day lowered systolic blood pressure by nearly 10 points, a huge result, especially when you're already taking it to support anemia. In patients with type 2 diabetes, L-carnitine significantly improved blood sugar control and insulin sensitivity. Most importantly, it can help reduce systemic inflammation, which is a major driver of kidney damage. All of this contributes to a slower decline in kidney function and lower creatinine levels. The recommended dosage: 1 gram of acetyl L-carnitine twice daily. While there are other forms of carnitine available, acetyl L-carnitine is the best choice for people with CKD due to its superior absorption and broader benefits. A word of caution about iron supplements. While iron supplementation can be life-changing for people with IDA, it's not something to take casually. Some patients already have excess iron, while others may not absorb iron efficiently and could require different methods of administration, such as injections or intravenous iron. This is not a one-size-fits-all situation. That's why it's essential to work with a healthcare professional who knows your full medical history and lab results before starting or adjusting any iron supplement. Only they can determine if iron is appropriate for you and how it should be administered. supplementing acetyl-L-carnitine, monitoring your iron levels, and working closely with your healthcare provider are among the most effective ways to beat anemia, lower your creatinine, and slow the progression of chronic kidney disease. Your kidneys are worth the effort, and the right tools can make all the difference. Okay, guys, that's our last point for today. And this is all for today. Thank you for watching, and God bless.